Congolese go through the hustle and bustle of Kinshasa on an ordinary weekend. But beneath this seeming normalcy lies the fear of contracting mpox. Health workers have recorded cases of the infectious disease in the DRC capital.
Kinshasa has many cases of mpox. Right now we have 11 patients at this hospital who we are taking care of.
While the city has not recorded as many cases as the eastern province of South Kivu and the western province of Equateur, health officials are stepping up measures to curb the spread of mpox. They've announced public awareness campaigns and the prevention of the infection and treatment. But they're facing some resistance from some people.
There
are some adults who prefer to go to churches to get prayed for instead of visiting health facilities. By the time they arrive at hospitals, the mpox virus is at an advanced stage. That's the reason why we have recorded many deaths.
According to the DRC Health Ministry, more than 500 people have died of mpox and 15,000 others have been infected since the beginning of this year. A new strain of the virus that is more deadly than the one reported globally in 2022 was detected in eastern DRC earlier this year. The strain, known as Clade 1b, has now spread to Burundi, Kenya, Rwanda, and Uganda. The mpox outbreak raging in the DRC has raised fears of a major global outbreak. 12 African countries have already recorded cases so far. That has led some countries across the globe to step up surveillance measures following the World Health Organization's declaration of a global health emergency. Chris Ochamringa, CGTN, Kinshasa, Democratic Republic of Congo.
Let's bring in Dr. Samuel Boland for more perspective. mpox incident manager at the World Health Organization's Regional Office for Africa. You're very welcome. Thank you for joining us. Dr. Boland, the world is grappling with the possibility of another major pandemic. What is the current status of infections and the spread of mpox on the African continent?
Yeah, thanks, Richard, for having me. It's, I think, first important to note that for most people in most parts of the world, we're not really thinking of grappling with another major pandemic like COVID was. But indeed, this past week, the Director General of the World Health Organization declared a public health emergency of international concern, which definitely does mean that mpox is a concern of ours that we have been and will continue to monitor and track really closely. And so far this year, 12 countries in Africa have been affected, with 9 considered to have active outbreaks. The overall number of cases is definitely rising, but I think a lot of the attention right now is because of the number of newly affected countries, particularly in Eastern Africa. And that's really because of this new strain of mpox, Clade 1b, which we're monitoring really closely because we do know that it can spread more easily. And I think the final key point here is that we should expect, as health authorities ramp up their surveillance, that we will find new cases in new areas, but that when we do, that's a good thing because it means that the surveillance is working, that we can get people the medical attention that they need, and ensure that we can tailor our response to contain outbreaks where they occur.
Well, Doctor, as you've mentioned, the health authorities in Africa are rushing to step up their surveillance and response systems amid more cases of mpox being reported. But my question to you is, what is the most effective way of controlling the cross-border spread of mpox from your perspective?
That's a really great question. And really the best thing is that people know the signs and symptoms of mpox, and that people that have those signs and symptoms refrain from traveling and refrain from coming into physical contact with other people. The way that the virus spreads, mostly within close contact within households or through sexual contact transmission, means that the WHO does not recommend any kind of health-related travel measures like screening or requirements for testing or vaccination. Effective surveillance, effective contact tracing, alongside robust risk communication and community engagement, those are the best ways to control the spread of mpox, both within countries but also across borders.
All right, Doctor, that leads me very nicely to my next question. Since January, more than 15,000 cases of mpox have been reported in Africa, according to some estimates. My question is, why did it take so long before the World Health Organization could declare mpox a public health emergency of international concern?
Yeah, it's a really great question. And the thing about a public health emergency of international concern, what we call a PHEIC, is that it's a really specific criteria that has to be met. And a lot of outbreaks, including outbreaks that spread across borders, don't meet those criteria. So as soon as there was indication that it might, Dr. Tedros of the World Health Organization convened this independent body of experts for an emergency committee where it was decided that it does meet that criteria. But the key thing to remember is that despite that, before that declaration, all the way through until now and moving into the future, the World Health Organization has been working really tirelessly with member states and government agencies and other partners to respond to the mpox outbreak. So we've already been working really hard, and we will be redoubling our efforts to make sure that we can monitor the situation and make sure that people receive the treatment that they need when they become unwell.
And finally, doctor, before we let you go, on the subject of response, are we likely to witness a surge in the production and distribution of vaccines against the mpox viral infection? And what supply challenges lie ahead for African countries?
We're really definitely excited to be bringing online vaccination as a tool that we can use in African countries. Right now, the major challenge, the major barrier has been primarily a regulatory one. But last week, the World Health Organization activated what's called emergency use listing, which should mean that in the near future, we can begin to get past some of these regulatory hurdles. And once that's completed, we'll be working very, very hard with partners like Gavi and UNICEF to make sure that these vaccines get out to the people who need them. We're already working really hard, such as in the Democratic Republic of Congo and Nigeria, to advance those conversations and get vaccines into arms as soon as possible. But finally, just remember that vaccine is one of many public health tools that can save lives. And the most important thing is to keep thinking about good surveillance and to make sure that people are aware of the virus, that they know what to do to protect themselves, and that they know how to seek help if they become infected. It's with all of those things together that we as the WHO, working with member states, can save lives.